Over time, the decline in testosterone levels in men can manifest itself into many symptoms. These include lack of motivation, fatigue, muscle loss, weight gain, loss of libido, erectile dysfunction, and cognitive decline. This is called andropause, and all men go through this at some point in their life. You're very likely here today to find relief to one or more of these symptoms. You want to understand what may be causing them, and ultimately learn the best path forward to resolving or mitigating these unwanted issues. Determining the right treatment, or treatments, can be an overwhelming experience. Often it requires clinical expertise to effectively find the right balance to manage your symptoms. Hormone replacement therapy is quickly becoming one of the most widely used treatments. First, we need to understand exactly what andropause is and the role testosterone plays in this process. Andropause is characterized by a gradual decline in testosterone levels in men. It's similar in concept to menopause for women, but unlike menopause, the changes men go through are not abrupt. Typically, men can start to exhibit symptoms related to andropause in their mid to late 40s, and more dramatically, in their late 60s. Testosterone is the main sex hormone found in men. It controls male physical features, growth of hair, building muscles and bones, and energy levels. Testosterone is produced by the testes and is at its highest level by age 20 to 30. After age 30 to 35, it begins to slowly go down. Unwanted weight gain is one of the first signs of decreasing testosterone levels. And it's one of the most important symptoms, as it can slowly or even entirely stop testosterone production. When you gain weight around your waist, you increase your level of an enzyme called aromatase. Aromatase converts testosterone into estrogen. And ironically, your body measures your testosterone level by looking at your estrogen level. As you put on more fat, your body produces more aromatase, and therefore more converted estrogen. Because you have high levels of estrogen, your body thinks it's producing excess testosterone and stops making testosterone. It's not just a vicious cycle. It's also a case where your body is literally fooling itself. Even a small weight gain can start the spiral, which is why it's important to monitor it. Another sign is extreme weight loss. Consuming far too few calories, such as 800 calories or less per day, can also trigger a decline in testosterone. With too few calories and not enough protein, your body thinks it's starving. It starts burning muscle rather than fat and shuts down testosterone production. Although it's unavoidable, aging is another sign. As you get older, your enzyme systems start to shut down. Because your testosterone is dependent on your enzymes, as your enzyme system shuts down, so does testosterone production. There are also a number of often overlooked medications that can cause testosterone to shut down. These include pain relievers like ibuprofen, naproxen, ketoprofen, aspirin, and opioids. And finally, stress, at home or work, can also cause a shutdown of testosterone production. So what is hormone replacement therapy, and how does it work? Hormone replacement therapy, or HRT, is the treatment of symptoms associated with hormone imbalance caused by andropause. By supplementing your body with the needed hormones, or balancing the hormones and levels, HRT serves to extend the time period in your life when you have normal hormone levels. This improves the quality of your life during your andropausal years. Using hormone replacement therapy to replace testosterone has been done for decades, and the benefits are proven. Clinical peer-reviewed studies show that testosterone replacement positively impacts libido and sexual function, bone density, muscle mass, body composition, mood, cognition, cardiovascular disease, and your overall quality of life. There are a few, yet critical steps to follow to effectively treat your symptoms. First, consult with your healthcare professional today to discuss your symptoms and medical history. You'll also need to provide blood work to test hormone levels. Based on your symptoms, hormone levels, and medical history, Your healthcare provider will develop a therapy plan. A specialty compounding pharmacy experienced in bioidentical hormones will also be included in this process. This ensures both the therapy and medications can be customized to meet your exact needs. Choosing the right pharmacy partner is a critically important piece to this process. The pharmacy's insights, ability to deliver medications in multiple forms, and technical analysis and reporting are so important in making your treatment as effective as possible. In 3 to 6 months, your hormone levels and the therapy plan in place are reviewed and optimized or changed to ensure your symptoms are being effectively managed and that your hormone levels continue to be optimized. The first step to optimizing your hormones to most effectively relieve your symptoms is to conduct a complete and total hormone panel via blood tests. You want to test your free testosterone, total testosterone, DHT or dihydrotestosterone, and estradiol levels. Estradiol is the most common form of estrogen. It's essential because it modulates your libido, erectile function, and spermatogenesis. Hormones are all related, so it's very important to know everything about them. Your body can convert testosterone in 2 ways that are bad for you. We call these negative pathways, and we want to block them. The first negative pathway is the conversion of testosterone to estrogen, which can lead to weight gain. We block this with anastrozole. The other negative pathway turns testosterone into DHT, which can enlarge your prostate and cause hair loss. We block this with finasteride. You also need a complete thyroid panel. The thyroid gland is essential to the endocrine system. These hormones play an important role in regulation of your weight, energy levels, internal temperature, skin, hair, nail growth, and more. You likely won't notice anything for 6 to 8 weeks, but then you'll start losing weight around your middle or gaining muscle. You'll also have more energy. You don't need to stay on the program for life. Stopping won't damage your hormone system. But if you stop, you will likely regress and end up back to where you were at the start of the program. The biggest fallacy in male hormone replacement is the notion that you can slap on some androgel or get a testosterone injection and be done. This is dangerous. It can thicken the blood and dramatically increase the chance of you having a cardiovascular event. While you have many receiving options, creams, gels, oral tablets, or capsules, pellets, and injectables, sublingual tablets have been shown to be the most effective form. Sublinguals provide consistent delivery, have a very high absorption rate, and are not subject to what is known as a first-pass effect. This means they are not ingested and avoid metabolization in the liver. Sublingual tablets also allow for immediate modification of your therapy in the event you're not getting effective relief of symptoms or there are unwanted side effects. Your goal is to ultimately get rid of all of your symptoms. Now, this is merely one of many reasons why your treatment plan should include a specialty compounding pharmacy. Compounding is the creation of a drug by a licensed pharmacist to meet the unique needs of an individual patient. A specialty compounding pharmacy is able to customize medications based upon your needs and your doctor's input or prescription. In addition to sublingual tablet delivery, which is the most effective form of medication for any HRT need, compounding pharmacists can put drugs into specially flavored liquids, topical creams, transdermal gels, suppositories, or other dosage forms suitable for a patient's unique needs. Further, a specialty compounding pharmacy possesses the technical and pharmaceutical expertise that general pharmacies just don't have. This is critically important for patients beginning nuanced treatment plans for HRT. Together with your doctor, specialty compounding pharmacies provide the triad of knowledge and medication delivery needed to effectively and efficiently begin improving your health and quality of life.